I'm Mark Ellis, Town Manager of Barnstable, and we're here to talk to you about the coronavirus situation here, certainly in our town of Barnstable, in our state of Massachusetts and beyond. With me are our Chief of Police, Matt Sonnenben, and our Health Director, Thomas McKeon. I'll turn over the meeting as I've completed my portion of this or presentation for my portion of this to the chief first to discuss what's going on within our police department, his coordination. Locally here is our emergency response official of other agencies and staff. His coordination specifically and some of the efforts of Cape Cod Healthcare. Then I'll turn it over for some concluding remarks to our Director of Health relevant to the Health Department and Board of Health's management of this issue. We want to thank our public and our residents for listening, for participating with us as we move through this very difficult and serious situation. As you know, our governor has issued a state of emergency, a declaration on March 10th relevant to this. There have been subsequent direction given to us, and shortly, as I conclude my remarks, with the help of our staff, we'll move through an updated website so that you all can access the same information that we have at one location. Basically, the most recent update has been relevant to our public schools. There are many updates, but the ones most relevant to us are public schools. As you know, our school department have closed our public schools. Initially, it was planned through the end of the month of March. With the governor's most recent order, that will put us through April 7th at this time, a restart on April 7th. I believe his order is through April 6th. There are also orders relevant to the closure of any public groups meeting that exceed 25 individuals. So that will have impact on us in many areas of public service that we offer within our community. In general, it is our intent to put public health and safety as our #1 priority, as it always is. And therefore, in an abundance of caution, since our initial discussions in February, we have been proceeding with that as our focal point. And we continue to do so. We have closed down our adult community center at this point. That is in the process of sending out notifications. If I back up a minute, our primary focus has been those populations that are at greatest risk as a result of this coronavirus. It has been identified to us by any and all agencies that the greatest group of risk are our senior population and those who have other compromised immune system related issues. So that has been our primary focus, though as we have progressed through this and looking at history, we understand that minimizing contact and eliminating large groups coming together can help us toward that outcome of protecting public health and safety. And therefore, we're not just limiting our efforts to our seniors or to those with compromised immune systems. We are looking at our entire community, and therefore our schools have proceeded and our governor has proceeded accordingly. We're going to be looking at municipal facilities where we don't have essential functions occurring. And curtailing those efforts, and in many cases, closing to the public, not closing for operation, those facilities, our community centers, our youth and community center, and others. The facilities that we do intend to keep open and do house essential functions are Town Hall, School Administration Building, 200 Main Street, our Police Department, and certainly the Marine and Environmental Affairs facility. And I will be coming out with further communications, certainly within the next 24 hours, relevant to this. And we will continue to communicate with you, both through these sorts of opportunities on Channel 18, on our website, and social media. And so please keep an eye on that. I am asking our communications director and supporting staff to make sure that we have very controlled messages. There has been much misinformation put out there by all that participate, and we have spent all of our time trying to control the information for the specific purpose of putting out accurate information that keeps you all informed as to where we are on these issues, and therefore can remain healthy and safe through this process. So you will see that aspect of it emphasized as we move forward, and I believe we've been successful in doing that. Our school department has many programs that they need to proceed with, and in future updates, I'll be asking our superintendent to communicate along with me on those issues. I've had a lot of telephone calls from people about, our younger population under 18 who need, who access various supports from our community, and I can assure you that our school department has taken that under review and is preparing plans to be able to go forward with continuing to provide those services during this situation. But again, I will wait until our school superintendent is with us so she can share firsthand that information. I've issued, as town manager, directives to our employees relevant to their attendance at work, when they should stay out of work. Now that the schools have closed, in the event that they have a child, we are certainly within manageable parameters granting them the ability to be with their child or children during this time frame. I expect many other requests as we move through the coming days and weeks of this, and we will continue to work with our employees to be able to manage this as best as possible. We've also issued some general communications on this in the form of directives about staying home, about what this issue of the individual, individuals, keeping themselves separated from others and quarantining themselves. There seems to be much confusion on this issue as well. My understanding of the way that this works, my non-medical understanding of the way that this works, and I'm sure our Director of Health can share more detail, is that if you have been in direct contact with somebody who it has been confirmed that they have the virus, then you should self-quarantine. This has been extended far, multiple people away. Well, I know somebody who might. That is not the scenario where you are asked to self-quarantine. It may be an appropriate precaution if that's something that you can do, but I'll leave that. But there has been much misinformation about that shared. So we will try to provide through the website and the links that we provide, we're going to walk through it in a second, as much good information so that you can stay informed, so that you can try to get back to some form of a normal life during this situation, and then hopefully when this concludes, post-situation. And again, we'll try to keep you as up to date as we are as this very serious situation progresses. If I might, our website, we have had up posts and provided updates since February 10th, but this is a new addition that we've put on our website. So if you go onto our homepage, if you click on if you click on the COVID-19 updates, which is on the upper left, right near the Town of Barnes Town Hall sign, you click into that, and it'll take you into various opportunities to access Board of Health updates, what the governor has said recently. As you scroll down, you can get into links to the CDC, Barnstable Schools, Cape Cod Healthcare, Barnstable County, State of Massachusetts, and other information, the World Health Organization. So other information. Up top, you can also go through and choose the different choices to try to access county information, town information, Board of Health updates, and then or go back to the home. We will use this as one of our many means of communication to you as we progress through this situation. I ask you all to remain patient, supportive. If you see something that you need additional support or have comment on, please reach out to us. And we will continue to manage this in a way that hopefully minimizes impact on the safety of our residents, of those populations that are most affected by this, and as we progress into the upcoming seasons, our visitors, if it extends that far. At this point, I will thank you for listening, and I'll turn it over to our Chief of Police, Matt Sonnabend.
Thank you. Mr. Ells, Matthew Sonnabend, Chief of Police. First and foremost, I want to reassure the public that the police department is remaining open. We are going to be still there. We are going to be answering the 911 calls. We are there if you need us in the case of an emergency. But just like everyone else, we also have to take care of our health, and we have to take care of the health of our staff. So what we do ask is if you do not need to come into the police department, or if you do not need to come in and conduct routine activity, please call us ahead. Schedule an appointment. We can have you come in, and we can take care of everything you need to do. You can contact us by Facebook through Messenger. You can contact us by email. You can certainly call, go through our phone tree, and contact the right person in particular, and they should be able to advise you over the phone of what you need to do. You also need to consider persons with firearms licenses. I know you're required to come into the police department. You can mail in your firearms license application for new licensees. We'll receive your license application, and we will contact you and set up an appointment time for you to come in and process the application. People with current licenses, contact the police department. We will walk you through the procedures that are being established to make sure that you get your licenses reestablished. Above all, we got to remember that we need to maintain our social distances and keep each other healthy. So make sure you're maintaining your 6 feet, washing your hands frequently, and keep your present state of mind, and we'll be able to get through this together. Thank you.
My name is Thomas McKean, Director of Public Health, and I want to say that the Health Division will remain open. Our phone number is 508-862-4644. You can call if you have any questions. To talk about the quarantine for a minute of any individuals, feel free to call us if you have any questions for clarification. At this time, the only people that are being self-quarantined are those who recently traveled to one of the 4 countries, high-risk countries, China, Italy, South Korea, Iran, or if you were in direct contact with a person who is tested positive, and when I say direct contact, within 6 feet of that person, if you're in contact within 6 feet of a person who was tested positive. The Health Division has taken a number of actions. In recent weeks, we visited all the nursing homes to make sure they're following proper protocols from the State Department of Public Health. We sent out notices to all restaurants to make sure they properly disinfect all surfaces and not allow any sick employees to come into work. As you're aware, only takeout is available at this time. We also visited the senior center, which, as you heard, is closed to programs or limited to programs. So if you have any questions, again, feel free to call us at 508-862-4644. Thank you.
Thank you, Tom. Chief, could you just speak briefly to the efforts in coordination with Cape Cod Healthcare?
Absolutely. Right now, Cape Cod Healthcare is in the process. If you go by CCH, there's a white tent set up out front. They're setting that up for the purposes of screening people to come into the hospital before they actually enter the facility to make sure you're routed to the right area of the hospital without creating undue exposure. There's also currently a drive-through clinic that's being established out at 4Cs, Cape Cod Community College, for the purposes of screening people remotely and conducting COVID-19 tests. That procedure is being established by Cape Cod Hospital, and you should follow the procedures of your healthcare provider in order to access that clinic. They're not looking for anybody to just show up there randomly. They're looking for you to work through your primary care to obtain an appointment and then visit the site after they tell you the date and time to come to the site.
Thank you. And that concludes our discussion of this today. We'll be providing further updates.